In 2008, Population Services Kenya embarked on an ambitious journey to transform the delivery of healthcare services for underserved communities across Kenya. An unusual approach was adopted. The investment would develop a social franchise model made up of small and middle-sized health facilities in the private sector. The franchise came to be known as Tunza, and over the past decade, it has become synonymous with high-quality care, innovation, and increased access to health services for millions. Tunza delivers family planning, maternal, infant, and family care services to over 3.5 million individuals each year through more than 400 private facilities that can be found in every county of Kenya. With 10 years of practical lessons under its belt, the Tunza Family Health Network is proud to share its story.
We came up with the brand Tunza, which means to nurture. And we thought if we bring together private sector providers under one brand, which is Tunza, and really build their capacity, their competences, and really try and demonstrate that this private sector actually can be harnessed. A lot of providers were not really convinced, so we were convincing them, can you join the network? Then after like 2 years, we realized now they want to join the network. So because they can already see what's happening, they can see the reality of the concept. The Tunza network is actually for real, it's branded. And the providers are also giving testimonies of how they're benefiting from it.
One of the things that PS Kenya was trying to solve in starting the Tunza franchise was to develop a network that we can regulate and support to provide quality service. When you train one staff, they leave, you have to train somebody else. That affects the quality of services that is offered. It's not an easy feat to manage, but for facilities where the owners are actually also clinician, when it comes to training, those are the guys that we target to train, because the owner is not moving, they're not going anywhere, and they're providing the services. So we train them and ask them to cascade this training to their staff. We work a lot with the Ministry of Health, and we do what are called joint assessments and joint supportive supervision at the county level. The counties are really proud of us and what we are doing in terms of assuring quality of services in the private sector. Even if I work in a Tunza in Kisumu, Mombasa, Garissa, I should expect the same standard of service that is being provided there.
Before we recruit a facility into the business program, there is sensitization where we need to understand if the provider is interested in joining the business program. So after sensitization, the clinic owner will tell you, okay, I think I can join the program. So we have a tool, a business measurement tool, with a set of questions that we use to take them through so that we can be able to measure where we started, and as we move along with you, we are able to measure progress. For us is to make sure that they make the right decisions. If they are going to acquire a loan, when should that happen? If they are to hire a new staff, what are the factors they need to consider for them to hire new staff? Can the facility be able to run sustainably in terms of revenues? Can the facility be able to offer, apart from quality service, are they able to offer good customer service to their clients? We are also looking at are they able to manage their stocks, and we are also looking how they are managing their finances. We look at how they market their businesses. If I can advise a provider to be able to run the business efficiently, where they minimize their costs and they are able to provide quality services, it's also a win to me, because I also have a family in Kenya.
As NHIF, we appreciate the fact that health insurance is a real thing that we cannot pretend we can do alone. There are so many players, there are so many actors, there are so many development partners who are interested. And because this is a live environment of health, it is just important that we work with all the stakeholders. Tunza as clinics And as providers, as health insurance, NHIF, we do not own hospitals. We rely on the third parties, or people, what they call them, HCPs, healthcare providers. We work with these healthcare providers because they are the owners of the hospitals, and these hospitals are the ones which are frequented by our members.
We know that if we have to achieve universal healthcare in Kilifi County, then we have to involve the the private sector, because the capacity that we have in the public health sector is not enough for us to actually achieve universal health coverage. So they are very big and very important partner in the delivery of healthcare in this county. So we appreciate them.
But the providers now have come to understand that franchising is about, working, moving in the same direction. And they have actually embraced the whole concept, and they see all the providers see themselves as a family and moving together in the same direction, whether it's the quality improvement journey, whether it is the business improvement journey, and they know that they have to adhere to some standards that the franchise has come up with. We have seen a lot of providers, when they learn from each other, they actually get inspired and they want to improve. The other thing they do is that they even form WhatsApp groups and they're able to encourage each other. So the peer learning, we didn't have that idea at the beginning, but we actually realized that it is very, very important, because this is a network of like-minded people. We are moving towards forming a network management organization, and we have actually formed it, and this is called Tunza Platinum. So Tunza Platinum is about bringing together the private health providers into one entity. For me, I'm very excited that Tunza had taken that, actually is the pioneer of thinking about, driving the agenda of the private sector forward.
The last client exit interview we had, 98% of the clients said they'll come back into a Tunza facilities and they'll refer somebody else to a Tunza facility.
It was revolutionary for us to imagine that we actually are making a difference. So even as much as we started with less than 100 facilities, it really grew very fast. And now we're talking about over 400 facilities as we stand. For Tunza to get here, we've not done it alone. We've had very many partners, whether it's our development partners, there's also the government, Ministry of Health. We work very closely with them. As part of our value proposition, we still have to work with the social insurance and other private sector insurance, which are very key players. We also have to think about investors. Before, we never used to think about investors, but as you look at a sustainable model, you have to think about who is there, ready out there to invest in a model like this to bring it to scale. Because for us, what's important is to bring to scale. And we know we can't do it alone. So that's also a very critical part of the partners we'll be looking at in the future, who can walk the journey with us for the next 10 years.
Sisi ni Tunza. We